Now next part of the treatment, as you can see, we can ask patient to be in this half squat, wall squat position. Now here also advantage is what, that because patient is directly in contact with the wall, we can achieve the posterior pelvic tilt, so it is going to activate your lower abdominal muscles, plus it is going to work on strengthening of the gluteus maximus muscle. So we are working on both the muscles in this exercise for the strengthening purpose of gluteus maximus as well as lower abdominals. You can ask patient to hold this position starting with the 10 seconds and then slowly we can progress it for 15 and 20 seconds of hold. Next part of the treatment includes strengthening of the hip abductor muscle. Now how to do that? So make sure that patient is in sideline position, okay? Also make sure that patient is comfortable in the sideline position. So for that I have flexed the lower leg from the hip and knee both. I am making sure that patient is supported well from the upper body. And then we simply ask patient to raise the leg in sideways in such a way that patient is activating maximum of the hip abductor muscle. Now if you want to make maximum advantage of it, slightly go for the hip extension and then go for the abduction, which will directly work on the gluteus medius muscle. So just hold this position for 5 seconds and then slowly keep it down. We can perform 8 to 10 repetitions of this exercise initially and then slowly we can progress for the more repetition as well as more holding position for strengthening of the gluteus medius. Now you could ask that why can't we perform this exercise in the standing position? For that, the first reason is because patient is not comfortable in the standing position, that we have already noticed in the assessment part, that patient was finding it painful while performing the hip abduction in standing position. So standing position will not be a good start. Initiate with the sideline position will be better because we are not causing any extra pain for the patient and also we are strengthening the muscle. For the next exercise, to stretch your hip flexor muscle. Now remember that we cannot go for bridging, we cannot go for prone cobra position. Why? Because already your lumbar spine is going for hyperextension, hyperlordosis. So those exercises are not advisable. But instead of that, we can use this half kneeling position. Now what is the best advantage of this position? Whichever side you want to stretch hip flexors, that will be down. Other side we will keep it in front. Now we simply ask patient to perform posterior pelvic tilt and contract the lower abdominal muscles. So it is like contraction of the lower abdominal muscle is going to cause stretch over your hip flexor group of muscle. So two things we can do in this, we can stretch the hip flexor as well as we can cause contraction of the lower abdominal muscles and posterior pelvic tilt, which is going to help us for the postural improvement of the patient. Let's relax. Apart from all this treatment, it is very important that we educate the patient about the condition and what not to do. We have to inform patient that they have to avoid prolonged standing, prolonged walking or prolonged sitting activities. For this, we can simply advise patient that more than 25 minutes you should not continue any one position. If patient is sitting for more than 25 minutes, just get up, they can take a small walk, again they can sit down. Or again, like bike riding, then they can just park their bike in a side after 25 minutes and again they can continue riding. So this way they are not putting continuous stress on the one structure and that will help us for the rehabilitation purpose as well. Apart from this, we also have to advise patient that they should make sure that when they are lifting something from the down, that time they have to be precautious. So it should be like they should not directly bend forward. Always it is better to bend the knee and after that carry something closer to the body and then get up, because that way we have a mechanical advantage. We are putting less stress over the spine and that will help to improve the condition for the patient as well as for the rehabilitation part of the patient. One more special advice that we have to give to the patient is from getting up from the bed. So whenever patient wants to get up from the bed, we have to make sure that patient is turning to the one side first, taking support of the hand to get up, keeping both the limbs downside and then getting up, because this way you are putting minimal stress over the back region and that can help again for our rehabilitation. One more advice we can give to the patient is when they are lying down, they can make sure that they are putting pillow, 1 or 2 below the knee joints, which will keep the spine in more posterior pelvic tilt, not spine but your pelvis more in the pelvic tilted posteriorly, and that will again help to maintain the curvature of the spine and put less stress over the lower back muscles. I really hope you understood this treatment protocol. Now this treatment protocol also we are going to progress it after a week. Like progression will be there in the treatment protocol as well. And that video also will be coming up soon. So stay tuned with Physio Trendz. And if you have not subscribed to my channel yet, don't forget to subscribe and share with your friends.